I joked before in our practice run that we are together, but we are separate because we wanted to make this a real and engaging Instagram Live session. And so to do that, we had to be separated so that we can be on separate accounts. So welcome to this very important conversation around monkeypox and how we break the stigma, but how we educate folks here in our community. So we have Dr. Roberts, who is on Instagram from the Columbus Public Health Official Instagram Live. So everyone say hello to Dr. Roberts, our health commissioner.
Hi.
And then we have Mr. Densil Porteous, Executive Director of Stonewall Columbus, doing Instagram Live from Stonewall's official Instagram. What's up, Densil?
How's it going? Glad to be here.
All right. And I'm Shannon Hardin. I have the honor of serving you as Council President here in Columbus. And I think I'm seeing folks outside of Columbus that have joined as well. So it's great to see everyone. We want to just go ahead and get started. One, I told Dr. Roberts this idea to do this Instagram was partly because of conversations and text messages back and forth between Densil and I. The community has been concerned around monkeypox, and so there's just a lot of education that we need to have that put out good information. And so I was wondering if Dr. Roberts could just give us some background, like what is monkeypox and how is it spreading?
All right, great question. And again, thank you both for being here with us to help us get this wonderful and valuable information out to our community. So monkeypox is a viral disease. It is part of the orthopox family, and it is a virus or a disease that we in healthcare have been very familiar with for many years. But typically this is a disease that we see in West and Central Africa, where it's endemic in that part of the world. It is not commonly seen in the United States. Previous to this year, when it was seen in the United States, it was from imported cases. Someone who had traveled to Central or West Africa, been exposed, came back, got diagnosed. So what's unique about this situation that we're experiencing now is individuals have not traveled internationally and are being diagnosed with COVID-19. With monkeypox. So what this is it is a viral condition that causes a skin rash. The skin rash is usually what we call pox or lesions. They almost look like chicken pox, and they can have a little bit of fluid in them. And they can be anywhere on your body, from head to toe. They can be on the palms of your hands, the soles of your feet, your face, your chest, your back, and it can also be in your private genital areas. I think what I really want to make sure that I'm clear with everyone listening today is monkeypox is not a sexually transmitted infection. It is a viral condition that can be spread from person to person with prolonged skin-to-skin contact or with contaminated objects. Those contaminated objects would be any objects that your skin has touched, notably cloth items. So we're worried about sheets and towels, potentially even clothing. But like COVID-19, monkeypox can be spread by respiratory symptoms as well. So that is why individuals who are diagnosed with monkeypox are advised to isolate until the rash is completely healed. And if they do have to go out into public, we ask that they cover their bodies, particularly the areas where the rash exists, and that they wear a face mask because it can be spread from respiratory droplets. So talking to someone for a prolonged period of time, sharing utensils, eating utensils, sharing a cigarette, sharing a straw, those are ways that it can be spread, but most notably it's spread from that skin-to-skin contact, and it's prolonged skin-to-skin contact. So it's not just brushing someone in a hallway by accident. It would be prolonged skin-to-skin contact.
So before I ask the next question, I want to encourage folks who are watching us to submit your questions just in the comments section. We want to make sure that we're having a free-flowing conversation and that we're answering as many questions as we can in the next 20 so minutes. Quick question, Dr. Roberts, is this a pandemic yet? Do we call this a pandemic?
No, we don't call it a pandemic. What the World Health Organization has called this is a public health emergency, and then the U.S. government has also deemed this a public health emergency. The state of Ohio nor Columbus, we have not deemed this a public health emergency yet, but that's always a potential, so just stay tuned. But it is not a pandemic, although there are 92 countries that have cases of monkeypox at this point in time. And what's interesting to note about that, of those 93 countries, the majority, over 80 of them, have never had a case of monkeypox before. And so that's what's really notable about this public health emergency is monkeypox is emerging in countries and places that had never been identified before.
Densil, again, I credit this conversation to you and just outreach that you did to me, saying, "Hey, what is our communication? How are we getting information out to the community?" So, what are you hearing as being on the front line of our community? What are you hearing from folks? What are their concerns, and how is Stonewall engaging with our residents to help spread accurate information?
Well, again, glad to be here this afternoon with both of you. I think serving as the executive director of Stonewall Columbus, which is the LGBTQ center here in our community, I think the queer community and the gay community have been aware of monkeypox as it sort of had spread and hit the coastal areas first and foremost, and I think density of population and activity is something that reflects that. I think one of the biggest things that the community is really wanting to ensure is that people understand that this is not a virus only susceptible to the queer or LGBTQ community, that this is something that anyone in any community can contract, and I think that's probably been the biggest concern, is any stigma that may arise, as it sort of may harken back to HIV/AIDS, and how community responded and engaged in that particular point in time. I think the other thing that people are really wanting to ensure or understand is sort of reflections of equity in relation to getting access to the vaccine, and ensuring that this is getting in front of the communities that are most in need.
Speaking of vaccines, Dr. Roberts, right now, who are we suggesting should reach out around getting vaccinated against monkeypox?
Yeah, great question. So let me just be clear with everyone that this vaccine is coming from our strategic national stockpile. That's a federal asset that as a local health department, as a city, as a state, we can't just go and order. We have to wait for the federal government to release it to us. And the federal government has made a strategic plan to release it to communities that have a large LGBTQI plus population. So Columbus was one of the first communities in Ohio to get access to this vaccine. So based on the data, based on the epidemiological data that we have of who is getting diagnosed with monkeypox in our community, we have limited the vaccine to those individuals at highest risk. And at this point in our community, individuals at highest risk are those who are 18 years of age or older, who are either MSMs, transgender, or non-conforming, and have HIV, so are HIV positive, have been diagnosed with a sexually transmitted infection in the last 12 months, have had multiple anonymous sex partners in the last 2 weeks, visit venues that have lots of sexual activity like bathhouses, or exchange sex for money or goods. That is the population that is eligible for the vaccine at this point in time in our community, and it's really based on the data, our epi data. So right now here in Franklin County, we have 31 cases of monkeypox that have been diagnosed. Of those, 100% are men. 100% are men. And the majority of them self-report as being MSM, but we realize some people don't feel comfortable reporting their sexual identity, and so again, the majority report as being MSM.
I'm seeing folks join, like my Spelman sister, Dr. Olivia Nathan, and it makes me reminds me that we're not in this alone, Dr. Roberts at Public Health. We're using community partners like Stonewall, like Equitas. Can we talk about our outreach plan? Like, how have we been touching communities where they are to make sure that folks are getting the vaccine who need them most?
Yeah, great question. So, we were very concerned from the very beginning about equity of this vaccine. And so we didn't want to limit the vaccine to only healthcare providers, because we know not everyone in our community is connected to a healthcare provider. So we were strategic. We talked to many of our partners, and when Columbus Public Health got vaccine, we redistributed that to some of our partners, some of them being Equitas, others being Ohio State Wexner Medical Center, AIDS Healthcare Foundation, because we knew they had relationships with the community that we were trying to get protected. And so we gave them vaccine. Some of them gave it to some of their patients. Equitas went to Club Columbus to give it out, where they already have a great relationship. They went to Stonewall to provide it. We wanted to make sure this was going to be available at locations that this population that we were really trying to reach out to had access to, felt comfortable going to, was familiar with. So in addition to those locations, we also provided them at the health department. And when we promoted our vaccine clinics, we were very strategic about promoting them. We went to dating websites. We went to websites and apps that this community was familiar with, was comfortable using, and so that we would be really targeting our promotion and our advertisement to the community that was at greatest risk.
Densil, how do we have this conversation, understanding the demographics of folks who are experiencing this the most without further stigmatizing the virus and how people see it and engage with it? Because we got to remind people that this is not a disease or a virus that spreads between men who have sex with men. Mm-hmm. It can spread throughout the entire community. But we are seeing data that is making us focus our outreach to a specific population.
Well, President Hardin, I think it's exactly the way you just stated it, as direct and as clear as that, right? I think once we start to try to soften language around how we're focusing our attention on community, then we start to misrepresent what's actually happening. So being very clear and saying that the reason why there's a focus on the men who have sex with men community and sex workers and others is because that's where we're seeing the highest rate of transmission currently. Being able to put sort of clear, concrete facts behind the information will disallow any sort of stigma to begin to rise in that particular space. And I think the reality of the way that we are addressing this also hopefully will curtail any spread into other communities and other areas. So when you look at the nucleus or focus of where a disease is spreading from and attack that, then you have the opportunity to ensure that you're curtailing any issues in other communities. So I think again, it's the data stating fact very clearly, and not sort of trying to soften the expression of why there's a focus in this particular community or a particular area. I think that's probably the best way to ensure that there's no stigma that becomes developed around it.
Dr. Roberts, do you have anything to add on to that?
No, I would agree. I mean, and that's why we always like to follow the data, and that's exactly what we're using. And every Thursday, we post the data on our website, the number of cases. Today, we are upgrading it so we can show you the breakdown by ages as well as by gender, so that you can clearly see, as Densil said, why the criteria has been set for who this vaccine can go to at this point in time in our area.
One of our first, I think, viewer questions that we've gotten in so far is, and what is the most common way that we're seeing this virus spread? And I think Dr. Roberts hit on this before, but it can spread in many different ways, but the most common way we're seeing this virus spread.
So the most common way is that skin-to-skin contact. I mean, people are most contagious when the rash develops. Now, before the rash develops, you can have what we call a prodromal period, where you could have symptoms that mimic other conditions like COVID-19. So you can have a headache, body ache, some fever, some malaise, just fatigue. But then once the rash comes upon, that's when you're most contagious. So that skin-to-skin contact is the most common way it's spread, but there obviously, it can be spread from utensils, from sheets, from towels. We have had cases of this being spread in households, where two individuals living in the same household got diagnosed with monkeypox, and then sometimes we've seen it spread to children within the household too. So it's something to think about and just to be careful for everyone. And recently there was a national story where it was spread to a dog. where 2 individuals had monkeypox and their dog slept in the bed with them, and their dog ended up being diagnosed with monkeypox. So that's a new one for us in the scientific field, so we need to learn more about this. And as I stated, this virus is very endemic in Central and West Africa, but what we're seeing with this particular strain of monkeypox is it's a little different than what we've seen in Central and West Africa, where it is transmitted person to person, which is not as common in Central and West Africa.
Dr. Roberts, and I'm thinking about, again, all of our partners out there who have been doing this work now for 2 years. You told us earlier that this is not technically a pandemic, but it's a health emergency, I believe you said. But we do still have a pandemic going on. How are health providers dealing with the strain of 2 health emergencies happening simultaneously, and maybe their impacts on disadvantaged communities, and how we educate, communicate, and do all of this work at the same time?
It's very challenging, and I can speak for my organization, and even when I talk to some of the healthcare facilities here in town, it's challenging to have 2 major issues going on at the same time. It's stretching our staff very thin. We've got 2 new vaccines right now that we're trying to get in people's arms. We've got the COVID-19 vaccine and booster. We just rolled it out, the COVID-19 vaccine, to those under 5 just a few months ago. And now we've got the monkeypox vaccine. I think the one thing that is in our favor is that the monkeypox vaccine, we don't have a large volume of the vaccine, and it's very limited to certain populations. And so that allows us to really focus on who should be getting the monkeypox vaccine, and it's obviously it's a small segment of our population. If it was the whole community that we were trying to vaccinate, that would be even more challenging. So I would just ask everyone who's coming in to get services, any type of health services, anywhere in our community, just give a little grace to your healthcare providers. It's been rough out there for the last 2 years, 2.5 years, but we're really doing our best, and our intentions are well intended, just trying to do our best to help you and help our community.
Densil, are you hearing from any members of our community that are feeling the blowback of the stigma? I know I talked to public health last week and heard of a situation where somebody thought that somebody breathed on them in the short north and wanted to get vaccinated. Are you hearing those kind of stories coming to Stonewall?
I think we hear them cursory, but not probably as much as the questions about access and who is able to find the vaccine and where they can get it. So I think it is disheartening to hear that those cases are happening in our community. But I think the prominence of questions or query is really, where can I find it, when can I get it, and which communities are getting information about it. So it has been not lost on, I think, any of us as we've watched how Columbus Public Health and our health officials have really tried to parse out the vaccine amounts as they've come into the community. And so I think that's just still the question. The main question is where can we get it? But again, disheartening to hear of any negative sort of outcomes of this.
Dr. Roberts, our second question that we have is, are only Franklin County residents eligible for the vaccine?
Yeah, so that's a great question. So when we first got the vaccine 2 weeks ago, only the 3 large metropolitan areas in Ohio were able to get this monkeypox vaccine, which is called Jynneos by the name. That's the name of the vaccine, Jynneos. And so at that point in time, it was given based on our population here in Franklin County. So we were very clear that we could only give the vaccine to Franklin County residents. Just last week, ODH, Ohio Department of Health, opened up vaccine ordering to other municipalities. So all municipalities in the state of Ohio can now order the Jynneos vaccine. Obviously not the same volume that we can order here in Franklin County, just because their population is smaller. So we are still trying to put restrictions of what we do to give it to Franklin County residents. That being said, if you seek health care in Franklin County and your healthcare provider has the Jynneos vaccine, they will be able to give you the vaccine because you you receive health care from Franklin County. But we are trying to make sure that we have the resources for our community and that we don't create something where people are coming into Columbus from all over the country to get the vaccine that is intended for our residents. And that has happened. We are familiar with people, we are familiar with our residents going to New York, going to Pittsburgh, going to other places to get the vaccine. And we want to try to protect our vaccine supply for our residents. And I just want to be clear with everyone. I realize the vaccine is very limited, and it's something that it keeps me up every night. But we have what we estimate about 40,000 MSMs that live here in Franklin County. And thus far, here in Franklin County, we have received less than 2,500 doses of the Jynneos vaccine. So not a lot of vaccine to cover the population who's at greatest risk. And so we're really doing our best to make sure that we keep that vaccine to use it for those who are at greatest risk at this point in time.
Dr. Roberts, as a policymaker, I'm starting to think through, so what are the recommendations? Somebody comes down with monkeypox. What are we telling folks to do? That's the first part of my question, because my second part is more of a policy question. So what do we tell folks to do if they come down with monkeypox?
So if you have monkeypox or you suspect you have monkeypox, obviously you need to go to a healthcare provider to get tested. And I want to make it clear to everyone listening that the testing for monkeypox requires you to have a rash. There is no nasal swab or oral swab like we did for COVID-19. You have to have a rash, and we have to be able to take a specimen from the rash and send that to the lab. So without a rash, you can't be tested for monkeypox. So if you are diagnosed with monkeypox, this is where it gets a little more challenging, because you have to isolate, meaning you can't go to work, can't go to school, can't go out for 2 to 4 weeks. That's a long time, especially for someone who has a job and doesn't have paid time off. And I can't give you an exact number because everyone's different, because you cannot come out of isolation until all of your lesions have healed over. So that means they've scabbed, the scab has fallen off, and new skin has come on top. That is when you can come out of isolation. And so for some people it might be 2 weeks, but if you have a very extensive rash, it could take up to 4 weeks. And I realize that can be a hardship for many in our community to have that much time away from, their life.
You 100% hit on the policy part of where I'm going with this. A lot of folks, especially if you don't have paid time off, how do we expect folks to stay at home? When COVID came around, we thought about these things because more folks felt that they were probably vulnerable to it. So we had to think about this for the larger community. Should communities, and have you seen other communities, other councils, other city states start to think about how we incentivize or help people stay at home for 2 to 4 weeks?
So I think from a policy standpoint as a country, we need to do a better job at that. If we can do something and set the example here in Columbus for others, I think we should. I think about the bartender, who gets diagnosed with monkeypox. If he or she doesn't go to work, they're not going to make any money. But at the same time, you don't want them going to work and making drinks for everybody at one of our establishments in town. And so we have to figure out a way, and our country just doesn't have that safety net, and we haven't learned from COVID-19. I think we put some practices in place, but we really haven't learned what we can do to protect people and encourage people when they are sick and they have a contagious disease like monkeypox to stay home and still be able to keep a roof over their head and food on the table.
Exactly. We have another viewer question. It says, how are patients receiving the vaccine? Is it via the arm?
Yeah, great question. So the answer is yes, it's via the arm, but I think I know where this viewer is going at. Just last week, the FDA gave emergency use authorization for the Jynneos vaccine to be administered intradermally. So prior to that, we were administering it subcutaneously, so right in the back fat part of your arm, like most vaccines are given. But because we are at a shortage, we don't have enough vaccine, we can't produce any quickly enough, we won't have any new supply coming in until early 2023, the FDA looked at several different studies that had happened and found that this vaccine, if given intradermally, provides the same level of immunity if given subcutaneously. The advantage of giving it intradermally is you're able to use a smaller dose. So it is a smaller dose than the subcutaneous dose, but it is the appropriate dose for intradermal transmission. So what does intradermal mean? It means we take your forearm and we take a needle and we put a little bit of the vaccine underneath your skin on your forearm. So it's still in your arm, but it's not traditionally where we've received most vaccines. Now, intradermal transmission has happened in other vaccines, not very common here in the United States, but your skin actually has a lot of positive immune response. So we're getting a good response and we're able to take the limited supply we have and vaccinate more people. And so we started doing that this week, and we have worked with our healthcare partners here in Franklin County, and we've said it's all together on this. So everyone here in Franklin County needs to do this the intradermal way so that we can really take advantage of the vaccine supply we get, vaccinate more people, and that we don't find our residents shopping around and saying, well, I'm going to go to this place because they're administering it this way versus that way. So we've all agreed we will do intradermal transmission. Now, that being said, if you're under age 18, you have to get it subcutaneously. The EUA is only for 18 and up, and the only contraindication for those to get it in with the intradermal administration method is if you keloid easily. And so if you keloid easy, the chances of you keloiding after getting the intradermal administration are greater. So if that is a concern of yours, then you can request that you get it subcutaneously, but that is the only contraindication at this point in time.
Thank you, Dr. Roberts. And we'll be closing up in about 1 minute, but we have one more a viewer question. Earlier I was asking, I have travel later this month. Are there places that it's spreading more, that we are advising folks differently? Is it like COVID where we have concerns, high risk, high spread, or should we take the same precautions wherever we are in this country?
So I think you should take the same precautions wherever you are in this country. Every state in the United States has at least one case of monkeypox now. And as you can imagine, some of our larger metropolitan areas have more than others. So if you look at the New York cities, if you look at San Francisco, California as a whole, Illinois, Texas, obviously those states have a larger population. They have the majority of the cases at this point in time. But no one is immune to this virus. And I would tell you that we should take the same precautions that we've been telling you all along from the beginning of the pandemic and even before, if those of you who remember when methicillin-resistant Staph aureus became a big deal, or MRSA. So we tell people, wash your hands. If you have sores, cover your sores. If you're in places with a large group of people and you want to protect yourself, wear a mask. Some of the basic things that we've been telling you all along will go and will be effective for monkeypox as well. If you're eligible for the vaccine and you can get an appointment, get vaccinated. Columbus Public Health opened up our vaccine clinics earlier this week. They're full. We're waiting for the next allotment of vaccine to come to us. When it comes, we will do it again. We will share it with some of our partners as well. But the vaccine supply is coming in slowly, and we're often getting less than what we were told we were going to get. So that makes it really challenging to schedule, to plan, and to share as well.
You answered our last question pretty well. It was if folks miss the first vaccine or the other vaccine clinics, when and where can they register? And then the second part of that question, though, is in how long are these vaccines effective?
Okay, so first let me answer the vaccine question. So when we get more vaccine available, we will be promoting it on our social media pages as well as some of the the dating apps and things of that nature. That's where we've been promoting it thus far, and that has given us a really good response, and we will continue to do that. As far as the effectiveness of the vaccine is a 2-dose vaccine. So you get 1 dose and then you get a second dose 28 days later. You get full protection from that vaccine 14 days after that second dose. Now, how long is the protection good for? And I hate to tell you this, but we don't know. We don't know. Because when studies were done on this, they looked for an immune response 2 weeks after. They saw the immune response 2 weeks after, a very positive immune response. But we don't have enough data to tell us, 4 weeks later, was it still there? 8 weeks later, was it there? So we don't know how long that protection will last.
All right. Do we want to have closing comments from folks? Just what is our message that each of us individually want to leave with the community as we, again, try to get good information out to folks? Make sure you're not just going anywhere. Just remember, like we acted during the pandemic with misinformation. Make sure that you're getting your information from credible sources. Even myself, when we want to post something around monkeypox, we go straight to Columbus Public Health to get that information. It's not coming from me; it's coming from from Public Health to make sure we're sending the right information. But Densil, is there any kind of last words, information that you think is really important for the community to know as we round this out?
Yeah. Well, first and foremost, I just want to say thank you all for coming together and having this really important and critical conversation in our community, for the queer community and just for Columbus in general. I think the most important thing for all of us to think about is our own personal health, but the health of others in our community. So if we have any opportunity to make space for someone else who may need the vaccine ahead of ourselves, please let's try to share that information with them. If we have the opportunity to connect with people who may not be privy to this information, do share that information with them so that they can get access to it. So I think that's the biggest thing, is that if we have any privilege or space and opportunity to not sort of jump to the front of the line, please do share that space with someone else who may be critically in need of it.
100%. As you were just talking, I was realizing that Ohio State University is coming back to session this week. You got a lot of young folks close together, and we want to make sure that folks who need it most, and there's no stigma here, folks who need it most, and we have the criteria about who we're recommending, get to the front of the line, that there's the vaccine for them. Dr. Roberts, are there any closing comments that you'd like to share with folks?
Well, I would just remind people that, monkeypox is now here. We do have it here in Franklin County. It is not sexually transmitted. Anyone can get monkeypox, but what we're seeing from the data that we have here, as well as nationally, is the majority, if not all of our cases, are in the MSM population, and that is who we're focused right now to get vaccinated. But everyone should be careful. If you have a rash, if you're concerned about it, you should seek health care to get a diagnosis to figure out what's going on. This is not a judgment of how anyone lives or what they practice. This is a virus that is spread from person to person. And at this point in time, we primarily see it in the MSM population, but anyone can get monkeypox. And so we encourage everyone to wash their hands, cover their cough, wear a mask if they're in large groups and gatherings, and cover rashes if they have it, because it could be monkeypox, it could be something else that is also contagious. So if you have questions, don't hesitate to call us at Columbus Public Health, 614-645-1519, and we'll be happy to answer your questions. And if you don't have a healthcare provider, we do provide testing for monkeypox at Columbus Public Health at our Sexual Health and Wellness Clinic.
Well, thank you so much. I just want to end by saying thank you to Dr. Roberts, to all of our partners, or our healthcare partners in particular, who, like we said earlier, have not really had a break in the last 2 years from these dual health emergencies, yet they have been providing excellent healthcare guidance and education to our community. So thank you so much, Dr. Roberts and your team. To our community partners like Stonewall, Equitas, to all those folks who are doing the great work out there, making sure that the communities who need this information specifically get them, and get it in the way that is true and finding space to get it to them. I'm just very grateful for them. The thing that I'm taking away from this conversation is, as a policymaker, the conversation we had 10 minutes ago about how do we keep people safe and at home when they get monkeypox is something that I will be talking to my colleagues and the mayor about over the next several weeks. How do we make sure that in Columbus that we can set aside some resources so that we can slow the spread of this thing? We know how to protect ourselves. We know how to slow the spread, but we also have to be realistic about what we're asking of folks to keep ourselves and our communities safe. So that's my takeaway, and so let's watch that space. But just again, thank you so much for this. I think this video stays up afterwards, so please share this. We want to get as much information out to folks, but we are very grateful for you for joining us this afternoon. Take care.